Hi guys! Welcome. How you feeling?
I'm feeling good. Of course, Nanja no carry last. Oh my God, my body. Better myself, better my body, and just better my health. I'm optimistic. Smile.
Smile!
The concern about me. Dr. Hassan, he came so many different times.
Yeah.
Just wonderful. Dr. E's clinic is on YouTube. People have to look friendly.
Yeah. Thank you guys and see you next time. Hi! Yes, so you have it again, and we have another session of All About Health. Hi guys! So, let's leave it here. I'm Lily, and as you all know pretty much, I'm the coordinator at Dr HE Clinic, International Patients Coordinator, and today we have a beautiful patient who came all the way from the US, and this is Miss Nosimot. Yay!
Hi, everybody.
Welcome. How you feeling?
I'm feeling good.
Okay, feeling good. You had your operation.
Yes.
We're gonna talk about that, later on. We have time, few minutes. So let's just start like that. And so first, you can present yourself. Where you're from,
Yes.
where you're coming from, and all that.
Well, my name is Nosimot. I am coming from the United States, DC area. I'm originally from Nigeria, so
Woohoo!
of course, Nanja no carry last. Yeah, just here getting my health right.
I have a few questions. I already kind of like told, Miss Nosimot how it's going to go, and just, to have a little bit of your journey and, how you came all the way from the US till here. You had your
Yes.
surgery, and just pretty much about the journey, and just to know so far, how is it going?
Absolutely.
Okay, so perfect. The first question is going to be that this is your fourth day, I believe.
Yeah,
right
it's my fourth day.
after the gastric sleeve. So first, after your surgery, how do you feel? Like, how are you feeling now?
Right now,
Yeah.
I feel much better than what I felt the day after. The day after, I was like, oh my God, my body.
Yeah.
But no, now it's the process, knowing that I'm about to go on a new journey to better myself, better my body, and just better my health.
Yeah.
So I feel happier each day as I go by. I'm taking it day by day by day. So.
So that's pretty cool. I mean, because some people, they do have the feeling that such a kind of difficult surgery can make a person go under like a week or 2 weeks, just lying on the bed and sleeping and no movement at all. But that's not the case for you.
I'm optimistic. I like optimism.
Yeah.
I always put my best foot forward, and my
Yeah.
best foot forward is to smile.
Smile. Okay, thank you. Now, I mean, obviously you came for your surgery. So you had a problem with, the fact of being overweight.
Yes.
So could you tell us a little bit about your journey with, the weight? Like, how did it start? I mean, for how long you've been, overweight,
Yeah.
and just till now, like you started with
Goodness.
weight.
To be honest with you, it's been years, and I want to say it started from college. Out of nowhere, just started to realize that I was gaining more and more weight. Would exercise, would work out, mainly would work out, which is exercise. Never really understood how to eat, what to eat, and what not to eat. I've lost the weight. I've, worked out. I've chose the foods. I've done everything correctly. But as they say, you work out a lot. If you stop working out, guess what? All the weight comes back.
Exactly. Now I have another question for you, and it's basically about the team. You came all the way from your country, and you came here, and of course you decided to go for the clinic.
Yes.
And Hassan Erdem was he's still the doctor, because
Yes,
he's going to
yes.
follow you eventually.
Yes.
But he was your surgeon.
Yes.
And then you've met the team also as well at the hospital. You met a little bit, some team members here at the
Yes.
office. But my question is going to be about, your thought, like the impressions and just thoughts about the team members, and especially at the hospital, because obviously you spent more time there. And also Dr. Hassan himself as, your surgeon.
One thing I want to always say is don't have too high of an expectation of anything, because when you expect too much, you don't necessarily get what you want.
Yeah.
But if you remain positive and say, you know what, I've made a good choice,
Yeah.
and then now meet each person,
Yeah.
then you feel so different. Me not having expectation actually made it sweeter, because by the time I started to meet them and saying, okay, maybe I should have an expectation, it became a thing of, oh my God, this is better than I thought.
Yeah.
Wow,
Yeah,
they're
got you.
wonderful.
Yeah.
And then meeting each person and just having the concern about me.
Yeah.
As much as they went in and out of my room
Yes.
during the past few days,
Yeah.
I was like, oh my God, I'm tired. But you know what? They care about me. Oh my God, they want to make sure I get better.
Definitely.
They're checking on me. The nurses, Dr. Hassan, he came so many different times.
Yeah.
Zainab came by. It's wonderful having Dr. Hassan, Dr. Saeed, Zainab, the
Yeah.
nutritionist. Just wonderful. I
Yeah.
mean, everybody just was so attentive. And I have to also say Eileen, the nurse as well.
Yeah.
And there was another male nurse that was there too.
Yeah.
I'm sorry, I remember names because
Yeah.
when you do so much for me and it's like, wow, I cannot believe you guys did all of this.
Exactly.
It felt good.
Yeah.
I love it.
Thank you very much for giving us the opportunity, to kind of like be part of your journey.
Yeah.
The other question is actually about you coming all the way from your country,
Yeah.
and you made a decision to go abroad instead of doing a surgery in your country, and then you decided to to go to our clinic.
Yeah.
So why not in your country? And then why us? You decided to go for us.
The whole idea of VSG actually started for me right during the pandemic. I heard about it,
Yeah.
didn't want to do the full research, so I put it off. And then all of a sudden, I want to say in this past year,
Yeah.
it started to hit home again.
Yeah.
And of course, Dr. E's clinic is on YouTube. You
Yes.
can YouTube
Yeah.
everything about his
Everything.
clinic
Yeah.
galore.
Yeah.
And for me, I just felt like, oh my gosh, no one else is giving this type of information. And I'm a YouTube person.
Yeah.
There's certain types of information that I need. Number one, people have to look friendly.
Yeah.
People have to look like they want people to come to the clinic.
Yeah. So, which is just now, you've had your surgery, you're feeling better. You
Yes.
went to the hospital today and you
Yes.
had your checkup.
Yes, I did.
I want to know about the new weight. How many kg have you lost?
Oh God. Okay, so
You
I'm not
remember?
kg, I'm more
More
pounds.
pound, yeah. So how many pounds?
2.4.
Woohoo!
Yes,
That's a
2.4. So
within
that
4 days.
yeah, that's what I was about to say. Within 4 days, people. Within 4 days.
4 days.
So, and there's many more to go. So,
Yes. So
this is just the beginning.
the beginning.
That's
So
the beginning.
congratulations.
Thank you.
Yeah. And so now, what's next for your future? What's next for about yourself, your life, the target?
Well, definitely life change of health.
Yeah.
That's the number one. Making sure that I make better choices with health. I love the fact that the nutritionist Zainab provided what we need
Yeah.
for these next 3 to 4
Yes.
months. I'm not happy about not having onions.
Exactly.
I'm not happy about not having my jollof rice.
Exactly.
I'm not happy about having my pounded yam
Oh.
and my amala
Oh.
with begidi
Oh.
and ewedu. Oh my God. But guess what? It shall return. Small though.
Small.
I give myself about 4 or 5 months before I
Yes.
get back to that. I really want to concentrate on the process that they've given me.
Exactly.
Develop that in a good way first. Because once you develop that in a good way, that will help me to be able to say, okay, now I'm bringing back some of my old foods, but I'm just going to bring it in smaller portions, way smaller portions, and still enjoy it. Know my stomach enough to say,
Yeah.
I'm full and stop.
Yeah.
They said that.
Yeah.
And I remember Natalie said that. And I'm like, okay, I think I'm about to go through everything, but we'll get there.
Yeah. No worries. No worries.
We'll get there.
Evan, by the way, do you have an ideal weight that you would like to reach?
Yes, I do.
Oh.
Should I tell you what my weight is now?
Tell us.
Okay, so actually this is weird. I know this in kg, so
Yeah.
I'm like, what? Okay, no, actually, let me rephrase that. I know what it was when I first came here.
Yeah.
So it was 97.4 kg.
Yeah. So within a year, you would like to be?
I would like to be, now in pounds,
Yes.
I want to say within a year, which is 2024, June 2024,
Yeah.
140. If I could be 140 pounds, I think
Yeah.
I'll be happy with
I
that.
think we could check. Maybe we'll eventually tell you guys in kg how much is it. But I believe it's probably around 65, 70. I believe.
Yeah,
60
something.
something. Yeah. So
60 something.
that means next summer, 2024.
Yes.
We're gonna shake the bum bum.
We
We're gonna shake the bum bum.
we are.
And now you just send me all the beautiful pictures.
I will, absolutely.
And
You're gonna get them, and you're gonna be like, what? What's going on?
You know, and hopefully, if you go to Nigeria, I mean, send us also that tropical
I
vibes.
shall be going to Nigeria. Yes, I love my home. So yes,
so.
I'll be going home, and yes, again, I'm just imagining the food. But anyway,
it's okay. It's okay. Small, eh?
Yes.
Small.
Absolutely, absolutely.
So thank you again for today, really. And we do appreciate, you know, and we're very, very thankful that you came all the way here.
Yes.
We wish you all the best. I wish you all the best.
Thank
it's
you.
not like the last. We're still gonna keep in touch.
Oh yes.
For the next few months.
I'm going to bother you.
Yeah. So
without a doubt, I'm going to bother you.
No problem. So again, yeah, guys. So that was it. Yes. Our little kind of like all about health, some special chit chat that we had with our beautiful patient. And yeah, so thank you guys, and see you next time. Bye.
Bye.